Thank you for joining us for the Springfield Business and Economic Review. I'm your host, Sarah Wolin with the Greater Springfield Chamber of Commerce, and today we have with us Jenny Collings. Jenny is the Director of Medical Development for the Greater Springfield Chamber of Commerce and the Quantum Growth Partnership. Jenny, thanks for joining us today.
My pleasure. Glad to be here.
We're glad to have you. So medical development in Springfield, what's going on? What are you focusing on right now?
Well, we have a couple of different focus areas within the initiative, and we're looking at workforce development in the healthcare industry, as well as public relations and marketing of the Mid-Illinois Medical District, and then finally commercialization of medical findings.
Now, one question is, why is there so much focus on medical? Why is medical important to our community? Why do we have all of this focus and initiative towards the medical community?
Well, really a variety of reasons. The medical industry is important on different levels, certainly personal. We all seek health care, and so we all need that quality of care, and Springfield has is a tremendous resource for those services. But the medical industry is also an area that shows great promise for economic growth. So it's important for us to continue the movement of expanding that growth, and it benefits the community as a whole because it can bring in new employees, new employers, businesses, create growth in general. So we're looking at it as a wide spectrum of economic growth.
So it really does position our community to be a competitive community, it sounds like. Some of the things you talk about are beyond if I need to go get help with my broken arm or allergies. It really is about our entire community being well positioned.
Absolutely. As we bring in new healthcare industries that, as you said, not only brings services for our community, but also provides resources and growth in other economic areas as well.
Well, that sounds great. One of the items you mentioned was the medical district. Can you tell me a little bit about what the medical district is and what's going on?
Sure. The Mid-Illinois Medical District is an entity that was created by the Illinois General Assembly, and the idea is to have this entity that can really create a focused and concentrated effort on building the medical industry and expanding the medical industry within a geographic region. So in our case, that geographic region is the area bordered by Madison and North Grand to the south and north, and then Walnut and 11th Street to the west and east. So within that area, we're looking to increase the medical facilities, research and development, any kind of growth within the industry. And so the Med District was created to really focus on that.
And it's something unique. I know there's a medical district in Chicago, but other than that, there's none other in Illinois, correct?
Right, that's exactly right.
It really makes us special, and it really allows us to focus on that. So I think that's great. And there's been a name change for folks who are not familiar with that. If they're hearing us talk about the Mid-Illinois Medical District, formerly known as the Medical District at Springfield.
That's correct.
So just as a point of reference, that was changed during last year's General Assembly session. So just a little wordsmithing, but still the same mission and focus. So I think that's great. Now, you've talked about a couple of areas with the medical initiative, and those are within Q5. And so can you tell me a little bit about why Q5 is focusing now on the medical industry as a whole?
Certainly. With the Q5 initiative, we're looking to enhance economic growth in general, and clearly the medical industry is a focal area for us. So the investors have identified the medical industry as a priority area because they see the potential for growth there. And so resources are being focused in that direction so that we can move forward and not depend solely on state funding or federal funding, those types of things. The community sees it as a huge priority, and they've put their money where their mouth is, so to speak, and are supporting that.
And that's just great because once you recognize how important it is, it can sometimes be frustrating. We've talked about the Med District not having any state funding, and it's a challenge. So it's great that Q5 has stepped up with private and public leaders to do that. I really am supportive of that, of course.
Great.
So also, you talked about a couple of three areas beyond the medical district that you've been focusing on. So maybe let's talk a little bit more about each of those, and let's start with workforce development.
Sure.
You said that through the medical initiative, you're focusing on workforce development. Can you tell me a little bit about what that means specific to the industry and what areas you're focusing on with that?
Sure, absolutely. We're working with the local employers, the major employers in the healthcare industry, to identify what their short and long-term needs are in terms of employment and workforce, and then working with them to try to identify how we can overcome barriers that are preventing them from filling those spots. Some of those areas are very large in terms of how you address and overcome the barriers. For example, the workforce, nursing workforce shortage. Everyone is well aware of that, and there are really some complex solutions, but we feel like bringing together leaders from the healthcare employers and talking about the unique barriers again can help us come up with some unique solutions to that, and we we have to find solutions that work for our community. We can't necessarily rely upon what works for the state or the country. We need to know what works in Springfield, and so we want to create a qualified pool of employees so that we can attract new businesses and we can have people up and ready to staff those new businesses and carry us forward.
It really is. As we look towards business attraction, one of the main things they're looking for is there a strong workforce there for us? Who's going to be working in my business or company in a couple years? And so specific to medical, I think that's great. I know one item in regards to workforce development you have made some progress on is through the Grand Victoria Foundation and working with incumbent workers. Can you talk a little bit about the focus on healthcare and how that program can work to help this?
Certainly. With the Grand Victoria Foundation, initially that project looked at ways to help incumbent workers move up in their career path, and that was that crossed all sectors of the workforce. Now, with this second phase of funding, we're asked to identify a specific sector, and it was agreed upon that the medical industry is where we should focus our attention in those healthcare employees because of the demand, because of the growth in that industry. And so we've created a proposal that will allow us to, again, work with the employers to identify incumbent workers within a field or crossing fields. For example, we could go for a person could be working in housekeeping, be interested in moving into the nursing arena, and we could help that person with overcoming the barriers that they're facing to help them move up those ladders.
Those support services and the support that comes along with that initiative with Springfield Works, it's just makes such an impact. It really changes people's lives. I think that's one example you brought up there. If someone's interested in adjusting their field within the medical community or moving up, it really can provide those tools.
Absolutely. I think also what's a great combination is the effort from the Grand Victoria Foundation project along with the Q5 initiative, because certainly in our workforce development there's more to address than only incumbent workers. That's a big factor, of course, but we want to look at retention, we want to look at new employees. All those factors are kind of meshing together to help us to address the overall workforce needs.
What are some of the greatest challenges that you've heard from either some of the major employers in the medical community or those who are thinking of coming about the workforce? Is it having people stay? Is it having people qualified? What are some of the challenges working to address?
Some of the challenges, well, one of them is finding enough employees. There's a huge demand in the healthcare arena. So we're working closely with educational institutions, and we have those services to provide or to train and educate more employees. Also attracting them to the area. We know that Springfield's a great place and there's a ton to offer, and we just have to get that word out, and so there's a marketing part of that as well. Retention plays somewhat of a role as well because of the shortage in this workforce. you can experience burnout as in any field,
Yeah.
but there's a huge demand again. So until we bring those numbers up, we see a little bit of a turnover because of the burnout.
Well, it sounds like there's great efforts and great partnerships being developed with that.
Absolutely.
So I think partnerships is such a key. You mentioned educational institutions and the major employers, so thanks for bringing those folks together.
Sure.
Another avenue that you discussed was commercialization. For those who aren't familiar with what commercialization is, can you walk us through what that process is and what that means?
Sure. Just in very general terms, commercialization is really just taking medical findings and moving them through a process to get them into the marketplace. And so that could be development of an instrument, a medical instrument that might improve the quality of care. It might decrease the length of stay in a hospital after a surgery, something like that. Finding that creation or that invention, working with researchers, and then going through the business steps that will get it into the marketplace. And that's a very lengthy, time-consuming process. So we feel through this MED initiative that we need to help provide those resources to the researchers so they can really continue to focus on research, and we can help with that movement.
That sounds great. What are some examples that we could see here locally, or where do you see this playing out within the medical community?
In terms of commercialization, well, I think we hope to see things like research and development businesses grow. There's a discussion about small business incubator systems, which would allow startup businesses the space and the resources that they need to get their business up and running. Also, it would provide some resources for management, again, so those researchers aren't required to do everything in addition to their research and their practice or whatever the case may be to get that invention into the workplace.
That sounds great. What are some of the steps? I understand it takes money to make this happen. So
Sure.
you've engaged some discussions with bringing in some venture capitalists or talking to those firms. What are those steps and where are we with that?
Sure. Well, we have had lots of discussions with venture capital companies, and it's a great opportunity to get funding to move through an initial or seed stage or gap funding stage, which is really a startup stage of a business, and then move that process once it's established, move the business forward into the marketplace. And venture capital companies, there are numerous ones right here in Central Illinois, as well as the St. Louis, Chicago area. So we're engaging those companies in discussion about what's the best practice of getting this started and moving it forward. We want to make sure that we're moving through in a very organized and thoughtful way so that we're getting the results that we want.
Sounds very thoughtful. Another area you mentioned was the marketing side of it. Can you tell me a little bit about that? What steps have been taken with that?
Sure. Again, there's a lot of collaboration going on between amongst all of the healthcare employers in town. And so we've been meeting with the marketing and public relations leaders within those institutions and really coming up with some creative ways to develop a very cohesive and transparent message about what the medical industry is all about here in Springfield. What do we have to offer to potential residents, to current residents? What do we have to offer to potential employers and businesses so that it makes it very easy for those people to see what we have in place and what's going on in terms of growth? So we're looking at redesigning the website for the Med District. We're looking at creating e-newsletters that can be sent out. We're looking at developing business toolkits that can be shared at trade shows or shared with businesses that express interest in our area. So they have right in front of them exactly what we have to offer, and of course they'll be very impressed with what's happening here.
Of course, I'm sure. Well, and it sounds like a way to bring information together. You talked about bringing together those marketing professionals. Which organizations are you talking about with that?
I'm talking about Memorial Health Systems, Springfield Clinic, St. John's Hospital, the Hope Institute, all of those primary employers in the healthcare industry, certainly. And they certainly have their own institutional marketing and public relations agendas, but everybody is really really on board in terms of making sure that providing an easy way for people to find information. We certainly aren't taking away anyone's identity, but creating a stronger message through the Med District, a more cohesive message.
Well, and it sounds like a great opportunity for each of them to even learn about what's going on at each other's institutions that
Absolutely.
they might not necessarily know.
Absolutely.
And you mentioned there's a website, and that website again is?
That is Springfield, the medical district at springfield.org.
Okay, and on that website, what type of information can someone find there?
You can find information about meetings. You can find information about the leadership of the commission. You can find information about available sites for development within the district. There are maps to let you know where things are. Strategic plan for the district, which was created a couple of years ago. So a wealth of information can be found there, with additions coming.
Well, that sounds great. We'll all, of course, look forward to that. I know one other thing that this marketing collaborative has done before is called a Medical Miracles booklet. And in there, it sounds like brings together both the commercialization side as well as the marketing side, and talks about some of the great things that are happening in our back door. Any thoughts or plans of continuing to share that type of information?
Absolutely. Those are the information that's found in Medical Miracles really highlights the research and the findings that are occurring here in the community. And that's the kind of model that we want to use to share with the rest of the state, with the region and beyond, to let them know what's going on. So we'll be asking for that type of information from each of these major employers so that we, again, can put it in one place so it's very easy to find. And that will be another way that those individual institutions can get the word out about what's happening.
Well, that sounds great. The other aspect in regards to the Q5 Medical Initiative is assistance with the medical district.
Correct.
Can you talk to us a little bit more about the medical district and who runs the medical district, who's in charge of it, and what they're stepping out to do?
Sure. The medical district is staffed with commissioners are appointed, and there are 11 commissioners. And then within that, the chamber is helping with some administrative responsibilities within the district. So we're helping through the chamber with incoming calls, providing information to people who are interested in learning more about the district. So there's certainly a collaboration there so that we can move forward in accomplishing the goals that were set forth in the master plan.
And the phone number, you mentioned that you staff the phone number now for the Med District. What is that number?
That number is 527-3908.
Okay, so for more information, of course, anyone could contact and call Jenny there and contact someone with the medical district.
Absolutely.
And the commissioners, I understand it's based on a region, so they cover the entire region, and you noted they were appointed. Who are they appointed by?
Some of them are appointed by the governor. Some are appointed by the city. And the numbers I'm not exactly positive on, so there's some from both sides. So there's a good combination of appointees and a really good balance from the business community, from the medical community, from other sectors of workforce development. So it's a really good combination of people to help guide this process and this collaboration.
It sounds like it. And the commission meetings, of course, are open to the public. They're public meetings. And where are those meetings and when are they held for folks?
Those meetings are held on the third Thursday of every month at 5 p.m. at the Lincoln Land Community College Capital City Center, which is located at 130 West Mason.
All right. So if anyone's interested, of course, you have updates posted on your website with meeting minutes and agendas and those types of things. But anyone's welcome to come, which I think is great.
Yeah, absolutely.
Next steps for the initiative as you're moving forward. We've talked about a lot of different things that you can be working on and will be working on, but what's next on the agenda? What are we looking to next now that you've just reintroduced this?
Well, I've talked a lot about convening groups and a lot of collaboration, and really what's going to happen next. We're shooting for a date early in May to convene a group of people within the healthcare industry that have an interest in promoting healthcare workforce development. There are a lot of projects currently going on in Springfield, the workforce development community, but we're going to bring all of those people together. And as I said earlier, there's a huge need in this field, and so we want to reinforce what's currently being done, but then within that same group, we also want to be very creative in finding ways that we can address the additional needs or the current needs of those places and find ways to work together and collaborate with resources as well as ideas, and from that meeting, move forward with a strategic plan and take some action.
That's great. And it sounds like a lot of community collaboration and working together, which just really is a great way to move it forward. And you talked about action. So this is not just all about talk about pumping up the medical community.
Right.
It really is about action. So I really think that's great. Now, of course, this is a new position for you. What drew you to getting involved with the medical initiative?
Well, I have a little bit, I have some background in workforce development in the nursing field, so I have a strong interest in that. And I also, with some previous projects I've worked on, came to realize that every problem or every issue has an answer at the community level. And so the Q5 initiative fits perfectly into that philosophy, and I'm very impressed with the movement of the project and the commitment of the project. It really shows great commitment to our community and desire to work together and really see growth and change. And there's a huge range of involvement, so that I was very impressed with that as well.
I think one other thing that's nice is that it impacts everyone in the community, any business, any individual, because not only for those seeking healthcare, but as this initiative grows and the healthcare industry grows, so do other businesses in our community, with kind of a ripple effect for it.
Exactly.
So anything in particular that you would hope that community members here in Springfield, Sangamon County area learn or know about the medical initiative or medical industry?
Well, I certainly want people to gain an appreciation for the fact that this initiative encompasses a wide range of activities and interests. Not only the development of businesses and the workforce, but there's also an aspect within the master plan for the Med District of neighborhood development, maintaining those neighborhoods and showing development there, housing development, providing resources that those neighbors need, whether it's restaurants or retail shops. You know, there's, as you mentioned, it's not just the healthcare part, but it's about the community in general. And geographically, this is one small part of the community, but it does reach out to all of us within the region. And so it's an effort throughout the region, not within those small boundaries, even though that's how it's geographically identified.
I think the housing aspect of that is so important, because as the medical district itself grows within those boundaries, it'd be great if those people can all live right there and walk. And so I think the focus on working with those neighborhood associations just really moves us forward in a positive direction. And I know that you've been working with them, and I really commend that. I think that's great. Any other ways that community members can learn more or should get involved? Of course, we talked about they can come to the meetings, they could call you. Anything that you would be looking for from them if someone had an interest?
Well, I'm certainly would welcome any interest in getting involved, and as I mentioned, there are really some varied ways that we're trying to move the district forward and move this initiative forward. So just having creative ideas and being willing to share those, I would certainly welcome the chance to talk about those and see how they can fit into the initiative in general. So calls, joining visiting the website, getting involved in the neighborhood associations and joining their efforts would be another great way.
Well, great. Let's just recap those areas that we had of important focus for you at the medical initiative. The first one was commercialization, and again, that's
moving medical findings into the marketplace.
All right, and making them grow and create their own business, which is just a very complicated process and very time-consuming. So great efforts on that. The second is workforce development, and again, what was that focusing towards?
Workforce development, creating or overcoming barriers to meet the workforce needs within the healthcare sector.
And then the PR and marketing aspect of this, which I think is important because it lets people know what's going on with all of this so that they can relate to it. Any specific steps you'd like to recap there?
Well, and again, we want to create a very visible, unique identity for the medical district so people are well aware of that. As if we ask someone on the street where it is, what it is, they'll be able to answer that. So that we want to generate that knowledge and interest in the med district.
And then again, that leads right into the next step, which is helping to coordinate and provide staff support with the medical district. Right. And again, the medical district is?
The medical district is, again, an entity that was created by the Illinois General Assembly to very specifically focus on enhancing medical facilities, medical opportunities within a geographic region.
So that really moves it forward.
Right.
As you move forward with this, what have been some of the greatest challenges that you've seen thus far with the initiative, and what's been done to overcome those?
Some of the challenges, I have to say, I feel pretty lucky. Everybody is really inviting and willing to participate, again, because it is such an important issue, and it is such a great opportunity to see growth in many different sectors within our community. So that really hasn't been a challenge at all. Everybody's willing to get together. However, those people who are willing to help are also willing to help in a lot of other areas. So of course everyone's schedule is busy, and that's a challenge, getting everyone together and making sure that we involve everybody who has an interest. That's very important to us, to hear the voices of people who have a desire to see this move forward. So we're making a very strong effort to do that as well. Keeping another challenge, I suppose, has been keeping everything in balance, because we are working on a variety of different
lots of balls in the air right now.
Right. Eventually, they'll all come together, and of course they all relate and derived from the master plan. So they're moving together, but as you said, a lot of balls in the air right now. They're all moving very, very, very well right now.
So all these balls are in the air. When they're all caught and all is going well, what's the ultimate vision?
Oh, good question. The ultimate vision is for us to see an increased number of employees in our healthcare facilities. Again, I've stated this several times, but there's a huge need. The employees are telling us, if we had these applicants today, we could hire X number.
If only we did.
Yeah, if only we did. So we want to see numbers there. We want to see that our efforts are making a difference in the numbers and the ability to hire new employees, the ability to retain new employees because they're able to hire new people. We'd like to see new business within the district that specifically supports the healthcare industry, but also that supports the needs of the current employers there, the employees, the neighborhoods, all of those different things. And then we'd like to see, as I just stated, a very distinct identity for the med district, that it's very easily recognizable, not just within our community, but within the region, and promote what's already happening and what will happen in this community. There's a tremendous amount of talent here, tremendous amount of opportunity and abilities in the medical industry. So we need to just get that out there and let people know.
Well, thanks so much for joining us today, Jenny. It's just been great to learn more about the medical community and the economic development initiatives within that.
Thank you.
Again, thank you for joining us for the Springfield Business and Economic Review. I'm your host, Sarah Wolin, and look forward to having you join us again.